coronavirus and it affected them, whereas it may be fatal than those who have taken the shot?
According to some of the reports, that's what I've seen. But when we talk about those who've taken the shot, the vaccine, or those who haven't taken it, regardless if you've taken it or not, you still might be exposed to the virus. And you're still going to have to fight the virus. So what we encourage people to do is make sure your immune system is strong. If your immune system is not strong, even if you take the vaccine, and let's say your vitamin D levels are low or compromised, your body cannot produce the necessary antibodies because in the absence of vitamin D, or when it's deficient, you cannot produce the antibodies you need to fight off the virus, even with the vaccine. So people who have the comorbidities like hypertension, high blood pressure, heart disease, diabetes, obesity, their chances of developing the antibodies and fighting the virus are reduced. So we need to deal with the comorbidities first, because in order to create a line of defense, you got to have on the right suit of armor. And without those, you immediately are compromised when it comes to your defensive mechanism in your body. So I encourage people to get plenty of sunlight, because your body going to develop and create and produce vitamin D, in particular vitamin D3, as a result in the skin layer from the direct exposure to the sun. Now, people who are dark skinned like me require a lot more exposure to the sun versus my Caucasian friends who can stay out there 30 minutes and get the same amount because of the differences in the melanin in our skin and the complexion and just the way God made us.
Yes, sir.
And so you're right when we talk about the people's chances of survival as a result of taking the vaccine versus not taking it. If you don't have a defensive system in your body, even with the vaccine, your body can't develop the antibodies so you can fight it off. And one of the things that concerns me, with the virus doing what viruses does, viruses mutate. And so these viruses are continuing to mutate as they get in our bodies and they use our bodies as manufacturing devices for more viruses. Mm-hmm. And a lot of the mutations, our bodies are able to fight them off. But if you don't have the right ingredients in your body, you don't have on the right suit of armor, it's going to be more challenging for you. And you may end up being hospitalized.
I know another big controversy that we have is the wearing of the mask and not wearing of the mask. I know a lot of people, they don't want to wear the mask, but it has been proven that the mask helps you from preventing from catching this coronavirus. What are your thoughts on that? And are we on the honor system? Because we have people who haven't been vaccinated that still are walking around without wearing the mask.
Well, one of the things I think people should do is everyone should get tested. You should get tested for the virus and you should get tested for the antibodies. Because like me, I was exposed to the virus and developed the antibodies in my system. And I think maybe a couple of weeks ago, I've been exposed to the Delta virus because I had all the symptoms. I had the temperature of 101. It didn't go to 103, but I had it at 101, and it lasted for about 24 hours. I had the sore throat, runny nose, and the cough. They lasted about 3 days, and the cough lasted another 2 or 3 days. But I increased my colloidal silver, which is as a nasal spray that we spray up our nose, because we know that the virus is airborne. And since it's airborne, that's the science behind wearing the mask. Because if it's airborne and it's in droplets, putting on the mask would tend to give you a barrier there. I think we should wear the face shields as well. If you're apprehensive about wearing the mask, then you should wear the face shield to capture the droplets if you're in proximity with people. Remember, it's airborne, and it can live on surfaces. So we still got to clean our surfaces. We still have to do that. Doorknobs. There was a report that came out. Some people might be catching it from gas pumps. So that's another thing. We might want to wear gloves when we're going out touching some objects that everyone is touching 100, 200 times a day. And so the mask, I'm concerned about the mask because if you have the antibodies, then the chances are your body's doing what it takes. And this coronavirus, believe it or not, it's not going anywhere. It's going to be with us for a while. And we have to decide how we're going to live with it. Like in China, they wear masks all the time. But, in America, we tend to want to do things our way individually. So some people will be pro wearing a mask and some will be con, don't want to wear the mask. I think to each his own. But remember, if you are a spreader, if you have the virus, then you should mask up to keep others from getting it if you're going to be in their proximity. It just makes common sense. And I think what people have to do when it comes to coronavirus and any condition that we have to use a little common sense. No one is asking you to put on a mask 24/7. I see some people riding in their cars by themselves with masks on. And I ask myself, why you got on a mask? There's no one in the car with you. There's no one to spread the virus in your car but you. And so I guess people just, they wear it, they get accustomed to wearing it. You know, like I said, to each his own.
Yes, sir. I know Florida, their governor is kind of like, he's against wearing a mask or whatever. So he's kind of like talking about penalizing like the system, the school system, whoever who are for wearing the mask. What are your feelings about politicians getting involved in this type situation?
Well, I can't be hypocritical because I am a candidate for U.S. Congress.
Yes, sir.
So, but what I can say is that I think the government should allow the scientists, the doctors, and all to let the science dictate what we need to do. I don't think Governor DeSantis should penalize superintendents and those who feel like they're better off not wearing a mask. I mean, it's just like if it's raining, do you wear a rain jacket, a hat, or an umbrella? I mean, what did you want to penalize me for my own lifestyle? And I think people who are going to be in an environment where they're going to be maskless, then you should have an option whether you want to be there or you want to, you know, stay home and do school virtually. We're going to have the hybrid method. I think we should focus on offering that as well. And so those who feel uncomfortable being around people who are not wearing a mask shouldn't be subject to that when they should have an alternative. I think that's what we would set up because it only makes common sense. Because some people's immune systems are not as strong as others. Some people vitamin D levels are lower. Some people have the comorbidities, and they're more susceptible. The Delta virus is 60 to 70% more transmissible. So you got to have some common sense in dealing with it. And I think the first line of defense is washing down hard surfaces, wearing gloves and masks when you're being exposed to others. And I somewhat disagree with Governor DeSantis on that. I think the government should pull back some and allow the scientists to help dictate that with true facts, though. Not just giving us information based on what they think we want to hear, but what the facts and the data say. That's what we should go by.
I know in a little while we're going to have the schools opening back up, and our children, our future, are going to be going back into the schools. Now, how will this virus affect the children, and what should we as parents do to help my child in this situation?
I think children should be tested before going back to school because it's shown that the Delta virus are affecting a lot of the young people, in particular the young children and young adults. So I think they all should be tested. I think they should have the virology test to test the nasal passage for the virus, and we should also prick their little fingers to test them serology-wise to see if they have the antibodies, the IgG or the IgM, if not both, and see if they have an active infection. There is no quick fix to this. There is no one way is the only way because everything is fluid. It changes. And if you're not willing to adapt with the changes, then you're going to be frustrated. We're going to have all type of crazy laws being created that don't have any common sense to them. And so if we're going to send the children to school, and then in DeSantis' case, if you're asking the kids to not wear a mask, then what are you doing to protect them? I mean, if it's my child or just other children, I did sports medicine for 30 years, and I worked with a lot of patients under the age of 18.
Yes.
And so the children are going to do what they're told to do for the most part, but they're very smart kids. Children are real smart, and they're going to study. They're going to listen to talk shows like this, and they're going to come up with their own conclusions. So I think it's going to be a fluid situation. Parents are going to get involved, but I don't think we should penalize teachers or principals for trying to do what they think is best for their school.
So how will this affect the teachers as well? Because we have teachers out there who's going to be in those classrooms with these children. And a lot of these children haven't been given the opportunity to take this vaccine. So they're putting themselves in that type of...
Yeah, and not just the teachers, but the teachers' families.
Mm-hmm.
Think about it. You know, my sisters are teachers, and they have probably 20 or 30 students in each class. And I'm hoping they have the barriers there, you know, the face barriers for the teachers, but also I think they should wear their face shields and their gloves until we can get past this surge. And people think that we can take vaccines and that's going to get us out of the surge. You cannot vaccinate out of a surge. And let me tell you why, Paul. It takes the body 2, 4, 6 weeks to develop antibodies even after you've taken the vaccine. So you can get the vaccine today, August the 14th. Next week, August the 21st, you still don't have the antibodies. Your body needs time to develop them. And you need to make sure you're putting the right nutrients in your body. The vitamin D3, zinc is another one. And there's a host of things. If people are interested in getting the list that I use, my personal use, that how I fight off the virus, because I'm sure I'm exposed to it all the time. And I wouldn't mind providing that to you. You can reach me at addisonforcongress.com, or you can email us at drmike821@gmail.com. And hopefully Ray can get that up on the screen. But it's drmike821@gmail.com, and I will send them the protocols that we use. And first thing you have to do is check with your treating physician to make sure you're qualified or you're eligible to use these protocols. But everyone that I've used them with, they've been very beneficial. Even we have something called Dr. Mike's VasoFlow, which we use. It's a nitric oxide boost because one of the problems that you have with coronavirus is a vascular problem, and it lowers your level of oxygen. So they ask people to get their oxygen levels measured. And so we produced a product called Dr. Mike's VasoFlow, and what it does, it boosts your nitric oxide levels. But it also has the over 2,500 international units of vitamin D3. It has the K2 in it as well, which the body needs to help build its immune system. And so I had no idea that I could use it for that because I created it for my mother who has COPD. And ever since she's been using it, she has not had to go back on the ventilator. And we're really proud of her. She still uses her oxygen because she has chronic obstructive pulmonary disease. But she continues to take her Dr. Mike's VasoFlow. And we have several patients and friends and family members who take it, and they do very well. Thank God we haven't lost anyone.
Yes. I know we have a lot of parents who haven't taken the vaccine yet. Now, if their child should happen to catch this virus, I know we wouldn't know where they caught it from, but should the parents be held responsible because they didn't take the vaccine to possibly prevent them from giving it to their child?
Not really, because we're in a pandemic. Some children take buses to school, some carpool, some walk. They could get it in any one of those routes. So we can't do that to the parents. We can't even do that to the school. We can't hold the principal and the teachers liable or responsible if a child contracts the coronavirus, because they could have caught it from the local vending store, convenience store, when they went in to get a pack of gum or a new charger for their phone. And so since you don't know where it came from, you can't just throw darts at people and just assume they are responsible. But what we can do is educate and inform people how to take the necessary precautions to prevent the spread. Because right now we're in a surge, so it's spreading. So we want to bring the surge back down. And even with the vaccines, that's just one form of helping to bring the surge down. But it doesn't stop the surge, because once again, the whole purpose of the vaccine is to help the body build antibodies. And in the absence of certain nutrients and with comorbidities, the body has a greater challenge at building the antibodies that you need to fight the virus, regardless if you take the vaccine or not. you still got to fight the virus. And I'm like, you either fight it with gloves on or gloves off. You still got to fight it because there is no treatment for it. There is no treatment. There is no treatment for viruses in this country. So they kind of run their course. So we go back to doing the things my grandmother taught us. She would put vinegar, lemon, and some other herbs in a pot of water and boil it and have us sniff the steam to help with cold and flu during the cold and flu season. Some of those old remedies, since we don't have a cure, you need to use some of your old remedies that your grandmother taught you. I think it'll be beneficial, as well as getting tested. Everyone needs to get tested, and not just once, but sometimes twice, 3 times, weekly. I think teachers, with this thing about punishing them or critiquing them, I think teachers need to be tested on a weekly or twice a week basis, because they don't know. Their kids are going home, they're coming back in, they're going out various places, but that teacher's in that same room every day. Every day. So we have to protect our teachers. And I think they should be tested. I think we should have testing centers at each school, in a nurse's station. I think DHEC should supply all the nurses there with testing devices, and some of the corporations should put in rapid testing as well. But some of the tests show that the variant is eluding the rapid testing. So, we've got to go back to the drawing board and start educating ourselves and developing products that we can use to fight off this virus.
I know we have some companies now that's making it mandatory for their employees to be vaccinated. Now, what are your views on that, especially when you have some people that have been living at home and working from the house, and now they're being required to come back to the job site, and now the companies are requiring them to take the vaccine to be at the location?
Okay, I'm going to put on my political face for this one.
Yes, sir. Put on your political face now.
Now,
okay, all right.
Think about it. Common sense. You have a company with 200 employees. You got over 75% of them working from home, and you're still meeting your numbers. First of all, I will let them stay home, number one. Secondly, if you're going to mandate that they take the vaccine, then you're exposing yourself to liability. I don't think you should run to the politicians and say, hey, I'm going to make them come back to work, but I don't want them to be able to sue me if they get sick and die. I don't want their family to be able to sue me, even though I made them come back to work and take the vaccine. See, you can't throw the rock and hide your hand. If you're going to mandate that they come back to work, then you should be responsible for some of that as well, and then go from there. And so it just depends on what's going on with that particular company. It depends on who's accepting liability. But who cares about liability when my sister is dead, or my mother is dead, or my daughter is dead as a result of you mandating that she come back to work and be vaccinated in the process, but yet the vaccine has not been approved by the FDA, yet we don't know all of the side effects. It's like you're damned if you do and you're damned if you don't. But I'd be damned if I'm going to go to a job because you're telling me I got to get vaccinated when you can't give me no guarantees about this. I don't even know the side effects. I don't even have informed consent because I don't know what I'm consenting to. So those are some of the downsides of the vaccine. I think the vaccine is important, but don't push me into it, and you can't tell me what effects it's going to cause. Now, from what we're seeing, we've given out millions of dosages, and we've had some people develop heart problems, some people develop clotting, but when we look at the number of people who've had ill effects or side effects versus the larger number, the risk, the benefits outweigh the risk is how it's scored. It's unfortunate that sometimes the person who received the risk could be your loved one. And that's the chance that we take in this uncertainty because we don't know. The data is not there yet.
Now, for the safety of the customers, you have a lot of restaurants and stores are now making it a requirement that in order for you to come to my restaurant, you must show me show that you've taken the shot. What are your feelings on that, and how will it affect those that haven't been vaccinated?
Well, let's use common sense. Even though I have the card where I've taken the shot, Now I still have a breakthrough infection. I have corona, but I'm coming to your restaurant with no mask because I have the card and I've been vaccinated. See, it doesn't make common sense to me. You're defeating the whole purpose. I mean, that's one line of defense, but I think we should continue to check temperatures at the door if you're going to allow people into your establishment. You need to ask people if they've been tested. You know, I mean, personally, I try to stay away from restaurants as far as large gatherings, but, you know, we're social people. Americans are very social. We're going to get out. We don't want to stay locked in. We don't want anything to deny us our freedom. You know, so we got to take the necessary precautions. That's why we go back to the drawing board of making sure your body's immune system is strong. So even in the presence of the virus, your body can fight it off. Think about it. People who have the cold are around you all the time. You don't catch it because they got it. Some people do, some people don't. Some people have the flu. Sometimes it's infectious, sometimes it's not. It just depends on the individual's own immune system. And I'm telling you, get that sunlight, wipe down those hard surfaces at your home and in your work and in your vehicle. Make sure you're taking your vitamin D3, your zinc. And if you got the virus, you want to make sure you talk to your doctor about taking the aspirin, something to help with anticoagulation. Because one of the things I was going to say earlier is that this virus has a vascular component to it. And some of the studies show that those who have contracted the virus and died, their body was full of blood clots. So we know that sometimes people who have the virus and have the antibodies, and then you go take the shot, sometimes it can create more problems in the body than good, and the body can develop something called a cytokine storm, which causes the system shutdown in your body. Your organs, your kidney, your liver, your lungs, they begin to shut down. And when they shut down, the next thing is death. It's imminent. So we ask people to take the necessary precautions. I don't think anyone should get vaccinated without being tested because it's just standard protocol. You need to know your level before you go take the vaccine. I had one lady call me. She said, my doctor told me to wait to take the vaccine because I just got over the virus and I got the antibodies in me. Very, very responsible doctor. She did the necessary things to make sure her patient followed the protocol. And the patient says she's continuing to have the antibodies and the doctor is postponing her taking the vaccine. I mean, everybody taking the vaccine is not the answer. But those who need the vaccine, getting it is the answer. But you got to follow the protocols. Even though we're in a pandemic, even though we're in a surge, this vaccine will not stop the surge. It just will not, because you won't have time to build an antibody.
I know there's a lot of discussion about how the negative and positive effect of the social media on this pandemic that we have, what they've been giving out, the information that they've been providing to the public, the negative and positive. What are your views on that, and how much of a important has the social media been to people taking the vaccine and not taking the vaccine?
I think there's been some misinformation out there. And it's like if I got to have work done to my car, the last thing I'm going to do is go to my doctor and ask him to take a diagnosis of my car and fix my car. Because he's not the expert. He doesn't know. So why in the world are you going to listen to someone on a podcast who has no medical training, never took a medical class, never treated a patient, never diagnosed anyone, and they're giving you advice on the vaccine? Because, see, what people don't understand, you can gather all the information you want, but the body works synergistically. All the systems work together. That's why whatever recommendations I make through my office, I always tell people to take that to their treating physician first. Because he's going to see their lab reports. He's going to see their blood pressures. He's going to know their vital signs. He's going to know what medication they're on, because some of my protocols may be a contraindication to what they're already taking. And so we do that with people who have cancer. And we take things as a chiropractor from a holistic approach. And people come to us with almost any condition. And our main thing is to work with the spinal system and the nervous system, because we know it controls all of the body. And we know that once we take the pressure off the nerves, the body can function the way God designed it. That's why I tell people, if you're sick, you're coughing, oftentimes it puts pressure on your chest and your back. Go see a chiropractor so they can get the pressure off of your nervous system. You're going to do much better seeing the chiropractor as your first line of defense, because there are no major side effects. Might be a little soreness if you're real tight and out of alignment, But other than that, that's it. The only side effect is you're going to get better. Your body immune system is going to get stronger. There's something called innate immunity. And we have an innate immunity which chiropractors deal with on a daily basis to help that body system get stronger through each treatment and following the protocols to use at home. So most people are concerned about the virus, the vaccine, and they're going online and they listen to social media. If you're going to take it off social media, take it to your doctor and ask them. If you can't reach your doctor, call us. We'll try to get you one. I'll give you the information based on some of the scientific studies and the data that we've collected. So what I say, this is a perfect opportunity now with this surge. I encourage people to stay home, especially young people, because the studies are showing that the young people are being hospitalized and they're dying. Ages 30 through 45 are dying from this virus, this Delta surge. And I even heard there's a Gamma strand now. And your body can adapt to these different strands, but the vaccine, I don't think it can. So we're going to have to create another form of vaccine for the various strands that are coming out. But if your body's immune system is strong, even with the vaccine, your body should be able to build the necessary antibodies so that you can fight this thing off. Listen, this thing is serious. This pandemic is serious. It's back at us again. We're in another wave.
I know, Dr. Addison, you show so much passion in providing this information to our community on this virus. Why is this so important, especially with you running for this position, that they know that you have a passion for their welfare?
Well, not just a passion. We've been doing this for 30 years. So we've been working with patients for a long time, thousands of them. We've seen a lot of different things come through. And what I do know, if your body immune system is strong, you're going to fight this thing off. So health awareness is one of the things that we're working on. We're taking our campaign and we're redirecting our resources to really focus on health awareness. We got to deal with the comorbidities, high blood pressure, heart disease, hypertension, diabetes, and obesity. We've got to focus on those things because just imagine if we can assist people with losing weight. And the vitamin D, another thing that's very important, vitamin D3 is stored in your fat cells. So if you're obese, you have less vitamin D3 in your blood system and more in your fat cells. So we encourage people to exercise. Very important. And also get plenty of sunlight. And so and stop drinking high fructose corn syrup drinks. Soda, stop it. If you got a soda at your home, pour it out now. Get rid of it now. Because high fructose corn syrup, according to the studies, it deactivates vitamin D3. So if vitamin D3 is deactivated, you cannot produce the antibodies, even with the vaccine. So you got to do every little thing you can and stop giving our children this high fructose corn syrup drinks, because that the parents can do. And give them something more nutritional. And find that on social media. Look into that. So we're going to work throughout the whole district. We'll be in 16 counties. We want to get with the first responders in every county. We want to reach out to all the mayor's offices to see what protocols they have in place, because nobody really knows what to do. This is very fluid. It's a case-by-case basis, and everybody's trying to scramble and figure it out. But we do know if your body immune system is strong, even with the vaccine, you can build the antibodies. And even without the vaccine, you can build the antibodies if your body immune system is strong enough. But you got to have the right things in place. Everybody should be seeing a chiropractor during this pandemic. Everyone should be seeing a chiropractor because they're going to help them build their body's immune system. And that is something we're not talking about, but we need to look at every facet of treatment that we can. But once again, Paul, I thank you for having me here with you. It's always a pleasure coming down here to hang out with you guys.
Yes, sir. Yes, sir. If people want to know more information about Dr. Addison, how would they go about doing that?
They can reach us on Facebook, Addison for Congress on Facebook. They can contact us, Dr. Michael Addison. If you Google it, we're everywhere. You're going to find us. But they can call us directly at 803-997-2260. And that is to one of the offices. And that's where the main office where we get all of our messages, 803-997-2260. because we don't want people to just take the information we have and run with it without an understanding. You become reckless with it, and you share it with others, and they don't know. If people are interested in managing their weight, we have a protocol to help them lose weight. I guarantee you they'll lose weight properly and in a healthy manner. And they won't have to change what they normally eat, except things that got high fructose corn syrup in it. We got to stop that because that's dangerous to us.
Dr. Addison, we're running short on time. Thank you for coming on this show. I look forward for you to coming back, talking more about your candidate, you're running for office, more about all different type of topics. Audience, thank you for watching this show. You be encouraged.